Can you give me a thumbs up if everything looks okay? Awesome. All right, so my name is Lisa, and I have a wonderful co-instructor, Tainayah, and we will introduce ourselves in just a minute. But let me give you kind of the lay of the land before we do some introductions. So today we'll spend quite a bit of time doing a course overview. And after I give the course overview, we'll spend some time doing an icebreaker. So even though we're going to do introductions in just a second, we'll spend a little more time getting to know each other. As you might imagine, in a class on community engagement, creating our own community in class is going to be really important for us to be learning together and working with community partners. We will have a break, and it's helpful if somebody can kind of put in the chat and remind us when it's break time. I am admittedly very bad at managing time in the classroom. I get carried away and excited, and then I forget, and the break goes to the wayside. But especially when we're on Zoom, we really need to take a screen break. And then when we're in class, we do too, because this is a 3-hour class. So without a break, I think we won't be able to learn as well. So can I have a volunteer to kind of be my break reminder today? All you have to do is write in the chat break time at 2:30. I see raised hands. So whoever, I don't know your names yet. Viviana, I think no, it wasn't you. It's the person right below you. Emily, is that you? Raised her hand?
Yeah, okay. I can do it.
Okay, thank you. I forgot I can't see very many people at once when I'm sharing the screen. Okay, and then we will do lecture and discussion today. So we'll talk about some community engagement kind of basics and introduction. And then we always have some announcements at the end or with assignments. And this year will be about room changes. Now might be a good time to say I have dogs and children who come and go. Sorry about the noise. Hopefully you can hear me okay. All right. So the goal of this course is to build knowledge and skills to employ community engagement principles in health-related research, but of very diverse topics. So this is something that Tainayah and I do in our own work. And while we have certain research interests, which we'll share in a second, we like to teach and help other researchers think about how they can integrate community engagement no matter what their research topic is. So it'll be exciting to get to know what your different areas of interest are and how we can apply community engagement to those areas. So we have some very specific course objectives for you. And I want to go through them. They are also available in the syllabus. Normally, when we meet in person, I provide the syllabus as a printout just so everybody can see it. But it's on Canvas, and I want to be sure to bring your attention to it. I have been updating it as we make tiny updates here and there. So if you downloaded it, you know, a week ago or something when we published the course, you might want to go ahead and download it again to take a look. And if you want to follow along in the syllabus, please feel free. So first of all is to argue the value of incorporating community engagement into research, recognizing that the traditional biomedical research paradigm doesn't normally include community engagement. So we want you to be equipped with the ability to argue for the value of incorporating community engagement. We'll spend some time examining our own identity and biases that inevitably we all have and how they might influence how we do community engagement in our research. So we'll actually spend half a day on that with a speaker who will talk about that as well. You're going to learn how to design effective plans for engaging different types of community partners, patients or stakeholders into translational research. We'll talk about ethical principles. We won't spend one specific day on it, but it will repeatedly come up in the different topics that we talk about. Learn how to apply different community engagement tools and strategies. Articulate the benefits, challenges, and solutions for community engagement in research. And finally, develop strategies for evaluating community engagement. Okay, any questions about the objectives? All right, you'll notice in the syllabus that these course objectives are listed there, and they're also objectives listed for each week that we meet. So you have a good understanding of what it is we'll be addressing week by week. Okay, so now we're going to do a few introductions. I'll introduce myself, Tainayah will introduce herself, and then I'll stop the screen share and you all can introduce yourselves as well. So my name is Lisa Goldman Rosas. I go by she, her pronouns. I'm an assistant professor in the Department of Epidemiology and Population Health. I'm an epidemiologist by training, and I have a master's in public health. I did all my graduate work at UC Berkeley in their School of Public Health. My research focuses on promoting health equity through chronic disease prevention and management, and I feel really lucky to partner with a lot of different community-based organizations and clinics throughout the Bay Area and the state. And I'm really interested in how we can evolve the science of community engagement. A little about my background, I guess. I actually, my first job was as a community health worker. And now, since we've been through the pandemic and everybody depends on community health workers, I feel really proud that I got to be a community health worker. I worked with migrant and seasonal farm workers on the East Coast in North Carolina and Florida, actually. I've also spent quite a bit of time in Latin America. That picture of me is on a stationary bike in Colombia. Colombia is a really cool place, in case you haven't been there. And it's one of the only countries in the world, I think, where recreation is considered a human right. So they have a lot of innovative public health programs that focus on physical activity, which is why I've enjoyed partnering with folks down there. And then looks like I included a picture of myself and my family, including my barking dog, which you just heard. So now you can see what he looks like. He's a big rescue dog with lots to say when anyone comes near our house. And that's my husband and 3 kids. And this year I have my daughter started Stanford. So really excited about that. All right, I'm going to pass it over to Tainayah. Oh, one more thing. You'll see we're using our first names, and Tainayah, I hope that's okay, but please call me Lisa.
Yes, also please call me Tainayah. But on the off chance you forgot how to say Tainayah, you can also call me Dr. Thomas if that makes it less awkward. But yes, I also go by she, her pronouns. And a little bit of my background. So my mom's family is from Panama, and my dad's family is from Mississippi. So I have that influence, and I think that has made a difference in the type of research that I want to do and that I've followed. I started my very first public health job was as a community organizer. And so I worked for LA County Department of Public Health, and I worked in Compton doing a lot of education and information around tobacco control issues, so smoke-free parks, smoke-free apartments, and spent a lot of time there before going back to graduate school, where I completed my PhD at the University of North Carolina's School of Public Health and Health Behaviorist. I'm not actually an epidemiologist. I am a behaviorist. I really focus on thinking about how we can support behavior change for patients and for communities and for populations. I've only been at Stanford for about a year after doing a fellowship at Kaiser Permanente. And so really thinking about how health systems and delivery systems can better deliver care to patients and make changes. And so a lot of my work is in primary care improvement. Because of my background, all of my grandparents had diabetes. I'm really focused on diabetes prevention and management. That is just like a personal goal of mine, and also focused on health disparities, particularly that focus on Black and Latinx populations, again, because of my background and who I am. So it's very nice to meet you all.
All right, let's see if I can stop share so I can see all of your beautiful faces. Awesome. Okay, so let's do just brief introductions. And if you weren't here at the very beginning, we will spend some time doing an icebreaker and getting to know each other. So for now, how about just let us know your name, the pronouns you prefer, Like Tainayah, if there's any challenges with pronouncing your name, feel free to let the rest of us know how to best do that. And maybe what program you're in would be really helpful. And to avoid the awkwardness of who goes first, I'm just gonna pick someone and then you can pick the next person. So Tiffany is right next to me. Would you mind going first, please?
Sure. Hi,
Thanks.
everyone. My name's Tiffany. I use she, her pronouns. I am a second-year master's student in the Department of Epidemiology and Clinical Research. Yeah, happy to be here. I'll popcorn to Emily. Oh, sorry. Sorry, I have a cat in the background. I'll popcorn to Emily.
Hi, I'm Emily. Sorry. And I am a first year Chippers master's student.
Thanks, Emily. You want to pass it to someone or did you freeze at the inopportune moment? Can you pass it to someone? I think we missed it if you said it.
Oh, sorry, my Wi-Fi is like really bad. I'll pass it to Jasmine.
Okay.
Hi, everybody. I'm Jasmine. I use she, they pronouns. I'm a Chipper master's student and a first year PhD student in epidemiology and clinical research. And I'll pass it to Sophia.
Hi guys, I'm Sophia. I use she, her pronouns. I am a first year Chipper master's student. I'm a coterm. And my undergrad, I was a hum bio degree. So yeah, very happy to be here. And I will popcorn to Fabri.
Hi guys, my name is Fabri. I'm in my first year Chipper master program and I use she, her pronouns. And I'll pass it on to Arjun.
Yeah, hi guys, I'm Arjun. I use he, him pronouns. I'm also a Chipper student, and I'll popcorn it to Anju.
I'm Anju. I am both a physician in training. I'm a fellow physician in pediatric hematology oncology and a first year master's student in the Chipper program. I use she, her pronouns. I'm really excited to join you all. I will pass it on to Viviana.
Hi, my name is Viviana. Sorry, I have a cold. My name is Viviana. I'm from Colombia. I'm a MD. I'm sorry. I forgot what I was gonna say. Well, this is my first year of my master's in epidemiology, and I identify as she, her. Well, I pass it to Clem.
Hi, my name is Clem. I use he, him pronouns, and I'm an undergraduate junior in international relations. Who is left?
Yajing, I think, hasn't gone, right?
Yeah, I'm
correct how I say your name.
No, that's correct.
I did it. Okay.
I'm Ya Jing, pronouns she, her, first year master's in epi and clinical research.
Great. Who did we forget? We have everybody? Okay, awesome.
Everyone did.
Great. Well, thanks everybody for sharing your name and information. It's great that everyone has their cameras on and we'll do some breakout room, but totally understand if you have bad Wi-Fi or whatever. We are well versed in being in school on Zoom, or if you keep getting kicked off and if you don't have a webcam, that's okay. We will make it through today and we will be in person next week. So thanks everybody. Actually, the reason that we're on Zoom is maybe worth sharing. So this class used to meet on Wednesday afternoons, but to accommodate some conflicts with classes that students like to take, both classes, we rescheduled it for Thursday afternoons. And when you do that, you lose your priority room assignments. And so that's why we have no classroom this week. And then we're going to have changing classrooms. So I'll talk about that in just a second. But that's the reason. All right. Back to sharing my slides. Oh, I didn't see what's in the chat. It's okay. Okay. All right. All right, everything look okay? Oh, I forgot to share all your.
Oh, and those are my grandparents.
Sorry.
In case anyone was curious.
Oh, yeah, I saw them come on. Sorry about that.
Oh, no worries.
Okay. We just did the introductions, and now we're going to do a little bit about course expectations. So a little bit about what we expect of you and what you can expect of us. And if you have anything to add or thoughts of how this might be revised, shout it out, or I'll open my chat so you can also put it in the chat. Actually, that's one of the things I miss about when we do in person. I've really loved having the chat function. I would have been a student that likes to contribute more on chat than out loud. So I like having that part. And now that I open the chat, I see Viviana, you said you were from Columbia when I was talking about Columbia. That's so cool. Okay, so what we expect of you to be on time to class, no technology during lectures, discussions, and especially during the guest lectures. I realize some of you like to take notes on your computer or your tablet or whatever, and that's totally fine. But I find especially in doing community engagement, listening with your whole body is really important, especially for guests. So if you can resist the temptation to take notes on your computer, we will provide all slides to you on Canvas. I know sometimes you think of something in the moment and you want to write it down, and that's totally fine. But to the extent you can be fully present, we will really appreciate that. You'll notice in the syllabus that there are readings listed for each week. The expectation is that you read those articles in preparation for the class, so before class meets. Obviously, there were some readings that are listed for today in the syllabus, and we don't expect you to have read them, but it would be great to read those before next week. Turn in assignments on time. And then most importantly, if you're facing any challenges of any kind, please reach out. We would love to work with you and support you, but we can only do that when we know. So please send emails to us if you are facing any challenges. And this is meant to be a really interactive class, just like community engagement is. So being engaged and enjoying it is really important as well. So in terms of what you can expect from us, we will do our best to be on time to class as well and not be using technology, to provide timely feedback on your assignments and be available to discuss outside of class. I have included this bullet of supporting you in these extraordinary times now, too many years in a row, but I fear that this is just the norm now. But you know, we are part of the Stanford community, and to the extent we can support each other is really important. So if there's any way we can be of any support, it would be our honor and pleasure. And I know I speak for both of us when I say we love teaching, and one of the most gratifying parts about it is interacting with you. So you can expect us to be engaged and having fun as well. Let me pause for just a second, make sure Tainayah has an opportunity to add anything.
Oh, nothing to add. Just again, please feel free to reach out if you need anything at all. And we're really looking forward to working with you all this quarter and hopefully in the future.
Great. Anyone, I don't see anything in the chat, but if anybody wants to contribute anything or put anything in the chat, please feel free. Okay. So now I'm going to kind of go over the syllabus just so that everybody has an understanding of what we're doing. Again, the syllabus is on Canvas, so you can take a look at it there. The basics are that there are 5 homework assignments. There are 2 peer feedback opportunities. There is a group project, which is a community engaged research plan. And there obviously is class participation, since it's such a fundamental part of community engagement. So I'll go through each of these components. Oh, our classroom shuffle. So we're on Zoom today. Next week, we will be in LK 101, which is a great classroom. And I think the week after that as well. Then we will go upstairs to LK 205, 206, then go back to LK 101. Anyway, you get the picture. We are going to have to help each other remember which room we are in when. So I will try to announce it at the end of class, and we will try to provide announcements. But to the extent you can help each other, make sure we remember where a class is. I think it's going to take a group effort. So sorry about that, but thank you for working with us on that. Let's see here. The next slide is about class policies, which you will see the policies listed in the syllabus, but I thought I would just go over them with you. So attendance. So we expect you to attend and actively participate and fully engage in all the classes and with the community partners. You know, active participation includes preparing for class and completing the reading assignments and engaging in the discussions. That being said, we definitely understand that situations arise, whether it be related to a pandemic, personal matters, whatever. So if you're going to be absent, please just reach out and let us know. We don't want you to come to class if you're sick, obviously. So just let us know and we'll see what we can do. I would like you to reach out to a classmate to find out what you missed before asking us, you know, what you can do to make it up. But we will try to do our best to help each other. There was something else I was going to say about that. I think that's it about the attendance. Then participation. So this is intended to be a very interactive class, which with substantial discussion. We want to be sure that everybody feels comfortable to participate and supported in asking any type of question or making contributions. We also understand that everybody likes to participate in different ways. So we'll have small group discussions and try to include a lot of ways that different folks can participate, and let us know if you're having any trouble with that. A significant part of the participation is actually meeting with your community partner outside of class. So that's also a great opportunity to participate if you're someone who doesn't like to speak out as much in class. Next week, we'll spend a lot of time on identity where we'll get to know each other even more. And our hope is that by creating that shared understanding, it will make you feel comfortable to participate. If you have any accommodation issues that we should know about, please reach out as soon as you can. Any questions about the policies? Okay, great. All right, so we have 5 assignments. Each one is meant to give you practical skills and experience in community engagement, except for the last one, which is a reflection. They are all designed to be activities that Tainayah and I do in our regular jobs, so they are very practical. We'd like you to upload the assignments on Canvas by noon, the day that they're due, and we will dock points for every 24 hours that they are late. So please go ahead and let us know if you have any difficulties with the due date. Okay. So the first homework assignment is the role of identity in community engagement. So the idea is to be aware of our own values, beliefs, and biases so that we can be effective at engaging others. I actually think community engagement or community engaged research provides an ongoing opportunity to learn more about yourself and how you interact with others. So there's 2 parts to this assignment. You complete a series of exercises in the order that you choose, and then you complete and submit a reflection. I want to draw your attention to one of the activities that we ask you to do, which is engage in a two-way conversation with someone that you do not know. So community engagement involves talking to new people, and that's actually a skill some of us have to develop. I am a more shy person by nature, so talking to new people used to be more of a challenge. It's not as much for me anymore because I've done it a lot. So this is something that you actually have to practice. It's not that only outgoing people, or what do they say, extroverted people do community engagement, not at all. In fact, community engagement is best achieved through listening, which some of us who are more introverted or shy are really good at doing. So it's really important that you find someone that you don't know, as opposed to someone you already know. Okay. And this one is actually due next week, so we're going to dive right in. Okay, the second assignment is called Each One, Teach One. And this is an assignment that we do so that we as a group gain a more in-depth understanding of different engagement strategies. And the way we do that is each of you are going to gain in-depth understanding in one engagement strategy and then teach the rest of us. So there are community engagement strategies that you'll choose in class next week, I think. And then you will do some background reading and prepare some materials. And then you'll come to class the next week and you're going to teach everybody else about that one that you learned about. The beautiful thing is you don't have to do it by yourself because several students will be assigned to the same strategy. You'll do the assignment on your own, but then when you come to class, you get to work in a group, develop some slides, and teach the rest of us how more about that community engagement strategy. So just as an example, let's say you choose to learn more about town halls. For your assignment, you're going to go do some readings about town halls. You're going to write up a one-page description of the strategy, and there's information in the syllabus about what exactly to cover. And then you'll come to class the next week. You'll find the other people that were assigned town halls. You'll develop some slides together real quickly, and then we'll have presentations from each group. Any questions about Each One, Teach One? Cool. Okay, the third homework assignment is called Compare and Contrast. And the purpose of this assignment is to understand how a traditional biomedical approach for research differs from a community engaged approach. So we give you a reading and then we'll ask you to think about how the study might be modified if patients or other stakeholders were involved in the research. And I give you kind of some detailed instructions on how to go about doing that. We'll talk more about that when we get closer to that assignment. Okay, assignment number 4 is about developing a community advisory board or a plan for a community advisory board. How many of you have heard of community advisory boards? You can raise your hand or your, yeah, okay, I see Emily has, or your emoji hand. I can't see everybody, but okay. So we'll give you, Sophia has, okay, thank you. We'll give you a research topic in class, and then you'll develop the community advisory plan, a board plan. This is something that we do in grants all the time, and develop community advisory boards for different projects all the time. So we'll learn a lot about community advisory boards. In fact, we're going to have a mock community advisory board in our class on February 9th. So you all will act as community advisory board members, and we're going to have a researcher from our department come in and give a presentation on their research, and you're going to give feedback as if you were a community advisory board. It's usually pretty fun. And actually, lots of researchers who have come to do the mock community advisory board have felt that it was so real that they've implemented the changes that students recommended as the community advisory board. Just as an example, there was a dermatologist who came and presented her project that was called Wipe Out Melanoma. And the mock advisory board, the students, felt like wipe out. No, it was called War on Melanoma. That's what the project was originally called. And the students suggested that the war metaphor was maybe not appropriate for the populations they were trying to reach. And so they changed the name to Wipe Out Melanoma. So now it has like a surf theme. Anyway, that was very cute. Okay, and the last assignment is a reflection on your community partner engagement, which I will talk about a little bit more in a minute. You'll find actually that reflection is a really important part of community engagement and a way in which we think about how our partnerships are impacting both us, but also our partners in the communities we serve. So here are the due dates. This is also in your syllabus. Once in a while, we make changes, like assignment number 5 often gets changed because we're working up against the deadline for our last bits of the community engagement plan for the group project. But the first 4, the due dates will most likely stay the same unless something happens. Okay. So we will also have 2 opportunities for peer feedback. And this part has been incredibly useful for all of us, actually, myself included. So you'll provide peer feedback on assignments number 3 and 4, and Canvas has a really nice feature that you can upload it directly to Canvas. So when we do the peer feedback, has anyone done peer feedback in Canvas before in another class? Nobody? Okay, I actually found this in Canvas and was pleasantly surprised at how easy they make it. So we'll do that, and I'll show you how to do it in class before we have to do it. And we'll give you a rubric to use to provide the peer feedback, just like we do for grades. Okay, and those also have points that go towards your grade. All right, let me stop for just a second and see if there's any questions about the assignments. Okay, so we're all good on assignments. I'm going to talk about the group project next, so I want to be sure we kind of switch gears. The assignments are all done individually, and I'm about to talk about a group project. Yes? Okay, great. All right, so this is what's called a cardinal course. Many of you may have taken a cardinal course before, and I think I heard someone was a co-term. Maybe it was Sophia? No, yes, maybe. So if you've been at Stanford for a while, you've probably heard about cardinal courses, but cardinal courses are supported by the Haas Center, and we have a small grant that allows us to pay community partners to take part in our class, and also provides funding if you would like, if you need transportation to go to a community partner, or if on the last class, I think last year we ended up on Zoom because of the pandemic, but if at the last class we want to have food and invite the community partners, we can do things like that. Okay, so the goal of the group project in partnership with a community-based organization is for you to learn how to develop a research plan in partnership with that community organization. The traditional way of doing research is I, as a researcher, decide what topic I want to do. I design the project. And if I need a community partner, I then go out and find one and ask them if they want to participate in some way. The ideal way for community engaged research is to develop the research idea together and for it to respond to the priorities and needs and strengths of that community or community partner. So in line with that ideal approach, you are going to go through the steps to develop a research plan with that community partner. In the 10 weeks that we have, and then 9 once you meet your community partner, we don't have enough time to do the research project, but we will provide a plan, and the community partners understand this as well. So next week, we have, I think, 4 community partners that will come to class. Some of them will come on Zoom and some will come in person. One of our community partners is from Pescadero, where there's substantial flooding right now. So she had wanted to come in person, but she may be on Zoom, and hopefully she'll have Zoom because they haven't had power for a long time. But anyway, hopefully we will have a few folks in person. And then you'll listen to the community partners describe their organization, and you'll let us know which community partner you would ideally like to work with, or maybe rank them so everybody can get a top first or second choice. And so 2 to 3 of you will work together with that community partner. And there are 3 phases. First, we do what's called co-learning. They'll teach you about their organization, and you're going to teach them about community engaged research. Then you're going to come up with some ideas, and they're going to respond to them, and you're going to discuss. And then you're going to produce a final community engaged research plan. Even though I've put these as 3 distinct phases, it's sometimes a very iterative process, but the idea is that you're in contact with your community partner weekly. It can be in person, but it can also be on Zoom, depending on you and the community partner and what's the most convenient. 2 of our community partners are in the East Bay. So most likely, unless you also live in the East Bay, you'll do those meetings on Zoom. Of course, if they invite you to come and you want to go, we can pay for your mileage to go to the East Bay and visit with them. And for one of the community partners, which is an integrative medicine clinic for cancer patients, you might really enjoy visiting their clinic. It is lovely. But if you can't, you can do Zoom as well. You can even get a massage and some acupuncture while you're there. Okay. So each week there is a suggested kind of milestone to move through the project. And this is also outlined in the syllabus. So we're going to form the groups next week. They'll come on Thursday, and by Friday, we'll send you an email with your group. And then right away, we'll want you to set up a time with your community partner so that they can tell you more about their organization and their priorities. And then next, you're going to provide them a presentation of what is community engaged research and how might it benefit the needs and priorities that they highlighted. Then you'll have some discussion, and then you're going to develop 1 to 2 ideas of research that they can respond to. And you probably do this twice. So think of some ideas, check in with them and find out, does that sound like something that they might be interested in, and how might they adapt it? And then go back to them a second time after you revise and do it again. And then you're going to work on the final research proposal for the last couple weeks, and we'll have presentations in the last 2 weeks of class. And they'll come to the presentations. Okay. So grading is based on 200 points, and you can see the homework assignments, peer feedback, the group project, and class participation. Okay. And then both Tainayah and I are really happy to meet outside of class. Tainayah's office is on campus and mine is off campus. We don't have set office hours, but if you reach out to us by email, we can set up a time either on phone or Zoom or in person. Do you want to say anything else about that, Tainayah?
Nope, that sounds perfect.
Okay, great. All right, so let me just stop the share and see what questions you have about the course content and assignments and things like that. Clear for now, and you'll ask questions as we go. Yeah. Okay, perfect. So I think, Tainayah, our next thing is the icebreaker. Are you doing that or me?
I think you.
Me, okay. Then I better share this again. All right. Okay. So like I said, it's really important for us to get to know each other a little bit more. And Tainayah and I are going to participate in this activity as well. The purpose of getting to know each other a little bit more is it'll be really important for us as we start to work with community partners and start to share ideas during class that we know a little bit more about each other's backgrounds. So the first activity is pair share. So we're going to form groups. I'll do the breakout rooms in just a second. And we're going to answer 3 questions. So what is one thing that you do to relieve or decrease stress? What is one thing that you do to create social connection? And what community issues are you passionate about? And we have a Jamboard, so you can, as you meet with your partner, write them down on the Jamboard. Has anybody not used some sort of whiteboard before on Zoom? Gonna be okay with it? February, that's a no, I haven't used the whiteboard function.
Yeah, I haven't
Got
used
it.
it before.
All right, let me show you. Let me pull it up. Okay, share, hold on. All right, so if everybody can go to this Jamboard. Okay, I see people joining, and then I'll show you how it works. Can you see my little Jamboard? All right, so over here on the left is a sticky note. So if you're talking about one thing you do to relieve stress, you can just write down the sticky note and it'll go here. Got it?
Yeah, thank you so much.
Sorry, not just for you, February, everybody.
Okay.
I'm sure you could have figured it out without me showing you as well. Okay, so let me make the breakout rooms. Of course, now I don't see the breakout rooms. Here we go. Okay. All right, I think once I do this, it will just send you into a breakout room. And then I will put the questions that you're supposed to talk about in the chat. And why don't we take, I don't know, like 10 or 15 minutes to answer the questions before we come back together as a group. Okay. All right, do people see the room they're assigned to? There we go. Emily and Yajing, you did the smart thing of leaving your breakout room before you got kicked out abruptly.
Yeah, pretty much.
Welcome back, everybody. I'm realizing that 2:30 is our time for a break, and I forget who was going to remind us about the break, but I'm wondering if we can push everything like 10 minutes back so we can have people report. Yes, is that okay? Sophia, were you the break monitor? Thank you. Okay. Thank you so much for doing that. I think now the pair share part about it is usually you talk in pairs, but we did more than pairs. And share now is just for folks to share a little bit about something that resonated with them or that they learned during the breakout room. So just spend a little bit of time doing that. So anybody can go. You can also scroll through the Jamboard and see what the other groups talked about.
I think this is Anju. I was in a group with February, Tiffany, and Jasmine. And I think one of the themes that resonated with me was this overall desire to address health equity. And I think as someone who is in a very traditional medical basic science driven field, it always makes me very hopeful to think about the way that academia and academic medicine can evolve over time by folks at different levels of training or on their overall professional growth of trying to really learn how to partner with communities and form change.
Thanks, Anju. Thanks for sharing. Yeah, it seems like that's a theme that our whole class shares, which is great.
Yeah, I can go. I'm Sophia, and I was kind of thinking a lot about the first question about, or not this first question, the second question about connection, and something that Arjun really mentioned was like being able to listen. And while I think that like that's incredibly important, I didn't take the question originally for, it's more like what I could give rather than what I could, receive. And so I think that kind of thinking about like connection as kind of that give and take, even from the very moment, is definitely like a different framework that I hadn't thought about. And like, yes, listening is incredibly important, but it was so interesting that my mind didn't go there, but rather what I could do to connect rather than allowing other people to connect with me.
Really cool. Thanks for sharing. Did you say that Arjan said that? And yeah, got it. Okay. That's so great. Thanks, Arjan. And thanks, Sophia, for recognizing that and sharing. That's great. Maybe a couple more and then we'll do break. How about what people do to de-stress? These are my favorite ones. I get good ideas.
For our group, I was in a group with Yajing and Clem, and we discussed a lot of like we all kind of said physical activity was like a thing that we like to do, like going for walks or hikes with friends and family. We also said napping, and then like watching TV, like watching Netflix or movies or anything like that.
Very nice. All good ideas. Okay, maybe one last person. One thing you'll take away, something that resonated with you. And scroll through the Jamboard and find something. I saw someone said cooking and baking. Who was that?
Oh, that was me. Um, so I guess a theme within our group with Tiffany, Jasmine, and Andrew that we discussed was like ways to create connection would be done through like baking and cooking, having dinner with friends. That can be a form of like cooking together. Yeah.
Nice. Yeah, I think that's a great one. I think food is a universal unifying activity in some way. I was on it was a community advisory board the other day. I can't even remember which one. And somebody said, you know, every culture thinks that theirs is the one that is so focused on food. Whenever you're talking about diabetes or anything like that, every culture you work with says, well, our culture is just really focused on, you know, foods and foods that are not healthy. And they said, every culture is focused on foods because humans are focused on food. That was really good. So I think a lot of times we always blame ourselves like, oh, but my culture is so food focused, or, you know, we have so many festivals and parties and things like that. And it's like, well, maybe that's just human nature. Okay, good. So I think we have a 15-minute break. So let's do that. That means we'll come back at 2:50. So you can turn your cameras off and be sure to be back at 2:50. I just opened my front door and realized it's not raining and it's actually warm.
Nice.
Not super warm, but it's not freezing.
That is fantastic. Only one day of reprieve, right? It's
so crazy.
Okay, I will share now. Is that the okay? Let's see. It's like no matter the fact that we've been on Zoom for like 2 or 3 years now, I'm always so slow to be like, wait, where's what I'm looking for? It's not gotten good at this. Okay, and then let's presentation. Okay, can you see my slides?
Looks perfect.
Awesome. Awesome. So thanks so much, Lisa, for kicking off the class and talking through the objectives and kind of getting everyone oriented to the class this year. And now we're going to spend the second half talking a little bit about an introduction to community engaged research and a little bit around the historical context for kind of how this came about. And so the objectives are to discuss this historical context for community engaged research and think about how that context has influenced the current state of the science of community engagement. Also listing through the principles of engagement and discussing how they can be applied across this translational research spectrum. And then explaining the spectrum of engagement from outreach to shared leadership. And so thinking about kind of where maybe traditional studies operate and thinking about where we ideally would like to go. And so we're going to start with a little discussion before we get into it today. Everyone signed up for this course called The Science of Community Engagement. And so we're curious to think about kind of what does community engagement mean to you? And that can mean kind of what do we mean by engagement, but also what are we talking who are we talking about engagement? So a what and a who. So does anyone have thoughts on either what we mean about engagement or who are we talking about engagement? Oh, go ahead, Emily.
So I think that a lot of, or at least what we've talked about in other classes, is a lot of the time, the traditional way to do research is to like figure out a problem, try to find a solution to it, create an intervention, and kind of place it on the people that you were trying to make the intervention for, without ever receiving feedback from them as to like what they maybe need or what resources they have available to them. And so I think that when we talk about community engagement, it's about speaking with and engaging the people that are actually part of your research into your project and receiving feedback from them to better understand their needs and resources and strengths and weaknesses of their community to best create projects.
Perfect. No, that's great. Thank you so much, Emily. Tiffany, I see you have your hand up.
Building on what Emily said, I think that engagement also kind of takes into account the idea of accessibility. That there are a lot of interventions that you can develop in a sterile environment in a lab, but to ensure that folks, all folks can benefit from that, I think requires understanding differences in communities or historical barriers to care. And yeah, that's why it's important to engage with the folks in diverse communities to better serve them.
Perfect. And Yajing, sorry, can you say your name again for me, please?
Yeah, it's Yajing. You got it right. Don't worry.
Yes, thank you.
I was also going to add on and say that community engagement is a very collaborative process. So more emphasis on the two-way communication rather than just one way. And then also I wanted to add that I think there's also the component of empowering the community and trying to leave it better than you found it.
Yeah, absolutely. Thank you so much. February?
Yeah, and I think to elaborate on what everybody else has said, and also what Lisa mentioned, is by being an active listener, and that is a form of engagement rather than always like doing like creating and implementing. We can just, be there presently and listen to what community partners and members have to say and what they want to improve for their own community.
That's great. Thank you. And does anyone have thoughts about who we're talking about engaging? So I've heard people talk about communities. I've heard people talk about partners. Are there any others that we think we're referring to when we talk about who we want to engage? Oh, yes, Sophia.
Yeah, when I think about community engagement, I think that like we often discuss it, or we have in our classes, just kind of about the impact that it can have to bring people into the scientific community to kind of work together. But I also think that it provides a really, really important perspective for the traditional community that's doing the research, such as, a research professional, an institution, a system of institutions, to be able to recognize like what holes there are in the processes that exist. And so if we wanted to implement something on a wider scale and couldn't talk to a whole community, we've at least started to fill in some of those gaps so we don't run into the same problems on a wide scale.
Yeah, no, that's an excellent point. Thank you. Okay, so let's see. Oops. Sorry, I'm trying. Oh, here we go. All right. I was like trying to move forward in the slides and it's not working with me. So what do we mean by engagement? So many of the points that you all made. So we're talking about this process of working collaboratively with stakeholders, our communities, our patients, our providers, to address issues that impact the well-being of populations through research. And there's really this spectrum of intensity of engagement that can be tailored to different phases of research. So from thinking about the research question to actually the implementation of an intervention, to thinking about how do we disseminate that intervention, through all of these phases, there's this level of intensity that you can engage in across these phases. And then who are we talking about engaging? Oftentimes when we're talking about health research specifically, we're thinking about patients and caregivers, providers and staff, community-based organizations. We're thinking about clinics and healthcare systems. We're also thinking about policymakers oftentimes when we're thinking about how can we leverage some health research evidence and put it into practice and put it into policies. Are there others that we could be talking about engaging that we haven't mentioned? I saw a hand. I don't know if it went up and then went down. Oh, Jasmine. Okay, I see it. Sorry.
Yeah, just kind of building off of what I think Sophia said, I think it's also really important to think about how this process engages academia and researchers and who specifically is doing the research, and sort of how we can invite community members into that process, not just like through engaged collaborative projects, but also through like actually running and being a part of like these academic institutions that are kind of writing the narrative of how we do research.
No, that's great. So often you're right. We do think about, us researchers leaving the ivory tower of academia to like hop in to other places, but also thinking about what opportunities are we offering community members and organizations to come and engage in academia with us, and thinking about it being really bi-directional and how can we support that. It's a great point.
Can I say one thing about that maybe really quickly? Yes. I think a lot of times you'll hear people talk about DEI efforts and community engagement as kind of like all one thing. And Jasmine, I think what you just pointed out, one aspect of that anyway, is the important overlap. So for our institutions to effectively support true community engagement, we need to think about who's here doing the research in the first place. And I think that is where there's a really nice overlap between some of the workforce diversity issues and then how we address health equity through research. But they also have really separate and different strategies, both of them. So whenever they get conflated together, I always try to remind the folks who put them together, that while they reinforce each other, they do have separate kind of goals and strategies. What do you think about that? Does that kind of resonate with what you were talking about?
Yeah, I think that that's very resonant.
Yeah. Okay, good.
Yeah.
Thanks, Lisa. Oops. Let's see, what did I click? Oh, there we go. So here is one definition of community engagement. As you know, with anything in academia, there are many definitions. But this one is a collaboration between institutions of higher education and their communities, whether that's local, regional, state, national, global. And here's the important part: for the mutually beneficial exchange of knowledge and resources in a context of partnership and reciprocity. And so really focusing on thinking about, is the work you're doing mutually beneficial? Is there a context of partnership and reciprocity? I think a lot of times ideas get conflated where people will say, oh, well, I did some interviews with some patients and they said they were interested in that. We did engagement. And it's like, that's not exactly what we mean by that. Kind of what there's more context to that. There's more, how was it beneficial to the people that you chatted with? How are you exchanging knowledge? How are you thinking about partnership? How are you thinking about reciprocity? And being very intentional about that. It's not as simple as like, oh, well, we asked people what they wanted and this is what we came up with. It's really being intentional about that. And as you can see, there are various ways that you can think about community engagement for different community engagement activities, whether you're thinking about education or clinical care or research or community outreach and community service or policy and advocacy. Community engagement activities fit in each one of these components, and really thinking about, depending on the type of work you do or what you're interested in, how can community engagement fit into something that you're doing. And we're really focused here on research. So while we can do community engagement in a number of other settings, we're thinking about health research in this context. And so thinking about kind of these community engaged research, community-based participatory research, thinking about how we can leverage practice-based research networks and patient-centered outcomes. So we'll talk about PCORI a little bit later. We'll talk about translational research a little bit later. So really focused on this, but with the knowledge that we can think about community engagement really in anything that we do. And so now we're going to talk briefly about kind of the historical context for this work. And so in the 1980s, the CDC enacted this REACH program. And so it was really at the forefront of thinking about how the CDC was going to try to reduce health disparities. And so REACH has actually been the only CDC program that's really explicitly focused on reducing chronic diseases for multiple racial and ethnic groups and communities that have high rates of chronic disease. And so in thinking about kind of moving forward from REACH, so that started in the 1980s, thinking about the National Institutes of Environmental Health Sciences program for community-based participatory research. So really thinking about how can we integrate CBPR in some of our national institutes. Thinking about 1998, the Institute of Medicine's report that advocates for public participation in research funding allocation. So thinking about how can we engage the community and thinking about how we set research priorities and how we allocate these resources. Now in 2000 and then 2010 becoming an actual institute, first starting as a center on minority health and health disparities. And so now we have an NIH Institute that focuses on funding minority health and health disparities research. In 2006, Clinical Translation Science Awards, so CTSAs, were established by NIH and recommended a community engaged research framework. So thinking about how are we including community engaged research in clinical and translational research that historically may have not thought about engaging communities outside of the health system. And then in 2020, the National Cancer Institute requiring a new component for funding comprehensive cancer centers and making sure that community engagement is a part of that. And I know that Lisa's been really involved in kind of supporting community engagement, particularly for, Cancer Center, and kind of leads some of those efforts. I don't know if you want to say anything about that specifically, Lisa, but.
No,
sorry, I did not think so.
I was taking a bite of my snack. There's no worries. I was just going to say we'll have to update this next year because I think a new significant a significant event, I guess, in community engaged research is that for the first time, NIH is now has a program where they accept applications only from community-based organizations for health equity related research. So academic institutions can be a partner, but they can't apply. So I think that's a significant evolution, I should say.
Absolutely.
At least from funding. Yeah.
Thank you. Oops, I keep moving the wrong way. Sorry, I don't know. Okay, here we go. Discussion. So kind of based off this conversation that we've had and even what Lisa just shared, does anyone have any thoughts about how you think that the historical context shapes community engagement or anything that you've noticed or you've heard of and how that may influence community engagement or even how you think about community engagement? Sophia?
Yeah, I'm just kind of like looking at the trajectory of making sure that minorities are represented in healthcare and that, you know, the community is involved in the care that it's receiving. It's still a little shocking to me that, you know, it like takes so long throughout history. It's so recent for us that we're seeing these developments. And so it really makes me question kind of how our medicine would look differently or would be different in general, just if we had, you know, included these voices and, you know, tried to collaborate rather than control through medicine. And so it really kind of raises my thoughts about like, what are we learning about in our other courses that like is biased and doesn't really have that really important, you know, viewpoint.
Yeah, no, exactly. Viviana.
Well, a quick comment on what you said, Sophia. Sorry, Viviana, and then I want to hear from you further. So one thing to keep in mind is in this class, we're going to focus on community engagement in the research process. And to the extent that research informs the type of healthcare like that you're talking about, Sophia, you know, I think, of course, that is really, really important. But I do want to make the distinction that Tainayah made in the beginning about how community and patient engagement is important for so many of the activities in an academic medical center or a university, from clinical care to education. This class really focuses on the research part. So I just want us to kind of keep that in mind. Does that make sense?
Yeah, it totally does. I guess I'm just kind of thinking about, you know, like with the research being the foundation for all of those things.
That's what I figured.
Yeah, I guess I specified in my thought that I was thinking kind of healthcare wise, but you know, the research that we're reading, you know, the process that we're learning, you know, what does it really look like if it wasn't until 2010 that we have a foundation for minority health, you know, how much of that, you know, that it's based on that we're founding here, you know, how much of that? Yeah.
No, absolutely. And I would say that the very first National Academy of Medicine kind of publication on health disparities that dealt a little bit with community engagement was all about the discordance between who provides healthcare and who's seeking healthcare, racial ethnic discordance, I should say, and communication between providers and patients. Now we talk a lot, you know, a lot more about structural and social determinants, but at least at the beginning, we're really focused on that healthcare setting, I would say. And I'll say one more thing and then I'll shut up. But when you go out into the community and you're from Stanford, even as a student, for some people, when they hear Stanford, all they think of is the hospital and how they're treated there. Sometimes good, sometimes bad, right? For other people, it's like the football team or something, I don't know. But it's not always what you're talking about, which maybe is about research. But definitely you hear a lot of people say, well, they don't treat people in my family there. I've never been there. I don't have access to that, or I had my baby there, but now I can't, you know, get an appointment, whatever. Anyway, so it all goes together.
mean, I was just as a preview, as we think about when we're talking about identity next week. I think so often when we start talking about identity, we're thinking about, our race and our gender and kind of our, kind of those things. But, as someone affiliated with Stanford, that is a part of your identity. And that is the context in which other people will view you as you go out into the community. And so being very aware of that other people's interactions with Stanford as the institution will frame how they view you as a person. And so being very conscious of that. Viviana.
Well, I would talk in my experience. I've seen like especially in my country, I think we kind of started the community engagement very like from the 60s. And that has been very focused depending, your social and economic context. And definitely I did it, like I went to neighborhoods representation on my school and talk people about prevention of dengue that is very prevalent, and as well as doing some feedback for, how things are going, how the people like from those communities are, responding to some of our, the research and everything that has been doing. So I feel like in the context, we have done a lot to prevent a lot of disease, focusing on what's prevalent in some areas and what is not. We kind of don't get too much into that. So we kind of look in certain areas, oh, here's like a lot of malnourished children. So we kind of go there, talk to the parents, talk, to the whole community. And I had like one experience, it was a very dangerous neighborhood. And we went there, but they wouldn't do anything to us because all what we had done as a community in my school. But they said if someone like looks like a student or anything, we will rob them. That's how they told us. We don't do anything to you because you're coming here to help the community and educate the community, or else you will be robbed. So that's, yeah.
So thinking about kind of this mutually beneficial relationship of, you build trust, there's reciprocity there, they feel like you've established yourself. And so it's like, you're allowed to come here because we know that we trust you and we built a relationship versus other people, maybe not. And so kind of how, that influences how you work with communities. That's so true.
Yeah, and there's a lot of people whose job is going to the homes of the people and just making sure that the kids are getting vaccinated, that like how the water is collected, because some neighborhoods don't have like potable water or any sort of, the drainage is not good. So their whole job is to make sure that the community is taking actions in regards to their health, regardless if it's environmental, medical. So yeah, I think it's really cool.
Yeah. Thank you for sharing that example. Let's see. Okay. And so in thinking about kind of what we've talked about, has anything stuck out to any of you about like why you should incorporate community engagement into your research specifically?
Well, I think depending on the needs of the people, like they're the ones who are having, let's say in a community that has some diabetes as their, like it's very prevalent. It's good to know the people, the individual, and treat it as a person, and that his or her opinion and their life experience matter. So that's why I really like it, because it's something that, you know, inspired. I feel inspired by that. And also I feel like it makes the research more valuable, in the sense that you are talking with the person, the people, and if they're willing to connect with you and be willing to share things, I feel like that's the best way to recognize the problems and what's going on.
Mm-hmm. Oh, yeah, awesome. Thank you, Viviana. And I see Tiffany, you have your hand up.
Thank you. Yeah, I guess at a practical level, community engagement makes your work, I think, more meaningful or more effective. I think that one we talked earlier about what exactly entails engagement, but I think a lot of it is understanding the communities you want to work with or serve, their perspective, to ask for their insights and perspective. I think that a lot of research would benefit from coming from a place of humility and understanding that it's not ivory tower of academia's lived experiences that you're trying to improve. So you should talk to the communities that you want to work with. Yeah, so on one hand, just more effective, on the other, allowing for more diverse opinions and perspectives that I think otherwise would be hard pressed to find in an academic environment.
Yeah. Jasmine, I see you have your hand up.
Yeah, I mean, I think this builds off of everything that's been said, but I really think that communities and members of communities are the experts on what they need. Like, we as researchers probably don't live in the same environment or see the same things day to day that a community member would, and that might be the best or most sustainable solution to whatever like health issue you are interested in addressing. And I think further, like going back to historical context, like for a lot of communities, there's a lot of mistrust between like research institutions and those communities. I'm Blackfeet, and I can kind of speak from like my community's experience. Like we have like tribal IRB, and like you have to have a community advisory board. And if you are trying to engage with Native communities and you're not incorporating like community members' ideas and thoughts and allowing them to co-lead that project with you, then you're not going to be able to engage community members. You're not going to be able to gain trust or repair some of those relationships that have been damaged through colonialism over time.
No, that's great. I love two things that you said, thinking about expertise, of thinking that kind of us coming in as researchers, we are not the only experts. And I feel like sometimes we often, when we work with communities, we treat ourselves as the expert. And the reason that it's good to engage communities is they are the expert on their needs. And so thinking about, again, that bi-directional share of expertise and information. But and also love your example of the kind of tribal IRB and thinking about kind of what are these engagement strategies? How can we make sure, what are strategies to make sure that we can ensure that the community's voice is present, that the community knows, approves our research, and has a mechanism in which we can co-lead that together. And so, you know, that those are some of the things that we'll be talking about in this course, of kind of what are strategies to make sure that we can be effective engagers with our communities. So, and we definitely hit on some of these. So why should you incorporate engagement? So it increases the motivation of patients and stakeholders to participate in the research. It increases the acceptability and feasibility of the study design and study logistics. It increases the reliability and validity of the study measures. It also increases the cultural and social relevance to the population included in the study if they are providing their expertise. And then it also helps increase the translation of findings to the next phase or into implementation. Also, because some people, you know, if we think about the carrot or the stick, some people will not do it unless they have the stick. And so funders are increasingly requiring it. And even if the funder of your current grant doesn't, the next one might. Institutions increasingly want to do it. Institutions who maybe realize how the perception of that institution in the community is affecting their research or the services that they're able to provide, and wanting to improve that. All CTSAs are required to include it. And as we mentioned early, all comprehensive cancer centers are required to include it. So, you know, it is something that as we're moving forward and as times change, a lot of funders and a lot of centers are requiring that we incorporate community engagement. And so it's a great thing to know and to be doing. And so what are the benefits of engaging communities in behavioral research for health equity? So better science, I think we hinted on that a little bit. It improves the research design, the reach, the efficacy, and the effectiveness. It can also increase the diversity of research participants. And in thinking about, I feel a lot of people are familiar with the lack of clinical trials that are diverse, right? And so in thinking about how often are we only going to communities to recruit them into clinical trials? Like, that's going to be a problem. That's not encouraging people to participate in your research if they do not trust you. And so thinking about how we can build better science by building better relationships. And then it gives you better answers. So it improves the translation of evidence to practice. It enhances relevant, effective, scalable interventions. So many interventions have been developed where no one chatted with the kind of the target population. And then when the intervention was rolled out, people were like, we would never do this. We don't go to these places. We don't, believe, we have this knowledge that actually isn't the gap. The gap is something else. And so using these, community engaged approaches help us really understand kind of what is the problem from the community standpoint, and then develop an intervention that addresses that. And it can also be used to bring about community health improvement and activation. When people are engaged and motivated and feel like they are equal partners in your research, when they feel like, oh, now I have the tools and we have other issues that may not be the issues that the researcher is focused on, but now they feel empowered to go out and work with other institutions, work with other researchers to address other issues, to build their own processes and engage in activities. It really can activate a community to think about other health issues. And it increases community trust in academic and scientific institutions. And so thinking about every action that you have with the community, especially if you have your Stanford hat on, is an activity that if it goes well, people might say, well, not everyone at Stanford. It's an opportunity to really think about for the next researcher who goes in and can keep building on these positive experiences and build institutional trust. And so I know Lisa talked a little bit about the readings, and again, we did not expect for anyone to have done the readings for today's class. So if you could just do them for the next week. I just wanted to just give you some context for these. So we have these 4 assigned readings. The purpose is really to just give you a high level overview of community engagement from various perspectives. So, we do not expect you to kind of read everything line for line and to have, to memorize these, but just to kind of read through them, to review them, to just get a high level understanding of the of each one of these, because we'll come back to some of these concepts as the class goes on. So this is really just to set a foundation of your understanding of community engagement, starting with this EATR article, which is from Nina Wallerstein's group. She is a luminary in the field of community-based participatory research. So this is, kind of foundational reading. To the Wolf article, that really gives a summary of why community engagement in research specifically is important. To the Forsyth article, so she is one of the directors of PCORI, the Patient-Centered Outcomes Research Institute, and it really gives an overview of PCORI's influence in engagement research. And then this last article, the middle author, Bob Ross, is actually a Haas Center Distinguished Visitor this year at Stanford. And so there'll be a lot of activities around that. And so and this also gives you an opportunity to think about the community perspectives on health equity. So not just kind of from this academic standpoint, but from a community perspective. So just really kind of read through these for general ideas, as they'll touch on topics that we'll come back to. But, again, we'll come back to a lot of the topics from these articles. Are there any questions at this point or about any of these things?
I just put a link in the chat. So Robert Ross, who's the article with Tony Eiton down here, the Building Community Power, So like Tainayah said, he's a distinguished visitor this quarter and next quarter, I think. And there's an event next week, and I think it might fill up, but I strongly recommend going. I think it's going to be great. And also both Anthony Eiton or Tony Eiton and Bob Ross are going to be speakers at our Community Health Symposium in April. So you'll have a chance to meet them as well. And I'll give you information about the Community Health Symposium later on in the class as it gets planned. But it's a great event and usually small enough where you can talk to a lot of these folks one-on-one too. So
great. So now we're going to talk a little bit about community engagement in health and equities. And so just the kind of, a small orientation. So health inequities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Community engagement and research is one strategy to address health disparities, but obviously not the only one. And so ensuring that diverse communities are included in the research process can ensure that in biomedical research that we don't exacerbate existing health inequities. And then hopefully that it leads to health inequity through identification and evaluation that addresses inequities in their root causes. And so here is this kind of spectrum of engagement, which we talked a little bit about earlier when we talked about both the spectrum of intensity and phases. So really the goal here is to think about how we can transition from working in communities to working with communities to kind of having engagement by and research by communities. So kind of moving from this in to by. So how bidirectional are we making this process? So, we usually, a lot of people think about informing. So we do kind of these outreach things. So we go into the community, we do my master's is in health education, did a lot of this, went out to communities, kind of educated and informed them about topics, right? Then you move forward to consulting them. So that's actually thinking about, okay, I'm asking you questions, I'm getting feedback. Then thinking about involving them. So how can I work directly with community partners and really consider their input and incorporate it? Then thinking about collaborating. So this is really about this, thinking about this equitable partnership with community, allowing the community to help define the research topic. And then going to empower. So thinking about the community initiating the research and taking a lead role in many phases. And if you think about this process, Lisa just mentioned them allowing community organizations being the lead for these grants. If you've worked with organizations kind of across this, that's really where you want to get, where it's not always the academic institution that's writing the grant and will write you in. It's having your community partner write you in as they address health issues. And so thinking about kind of how can we reframe that? How can we think about how have we gotten to the end of the research project? Obviously, we've met, hopefully you've met your objectives as a researcher, but like what have I empowered the partners that I'm working with? What have I given back to the community? Are there tangible things that I think that now, because I have worked there, they have a benefit, not just me having a benefit? And so in thinking about health research specifically and thinking about translational research, which we've talked about a couple of times. So I'm not sure if everyone's familiar with kind of the different phases of translational research. So we'll go over them briefly here, but thinking about kind of moving things from basic science research to kind of human research, thinking about clinical research at this kind of T2 phase, thinking about how can we put it into practice and have it be evidence-based, and then thinking about this last phase, which is how can we translate it into community and have it work on population health level. And so, at any phase, you can think about engagement, but really as we think about this T3 and T4 stages, really as a place for community engagement and to thinking about how can we truly partner with communities to move from phase to phase. But even thinking about, in this this recent COVID era, thinking about how working in some of these other phases, we've had to really engage communities in order to conduct COVID-related research and how that can be translated into policies, into population level research. does anyone have, I'll go back for a second. Does anyone have any thoughts about kind of translational research and community engagement in these phases before I move to the next topic? Okay, perfect. So now we're going to briefly talk a little bit about principles of community engagement. And so there are really 3 categories of these principles. So the first is items to consider prior to beginning engagement. So these can be things like the context of the health issue. Is this problem actually a priority for all partners, or is it really your priority and everyone else doesn't really care about it, or is there because you're going to give them some money to do something around that? Just knowing that in advance. And then also the history of collaboration between the institutions. So thinking about trust. So again, has someone else from your institution worked in this community before? Has someone even from another institution worked on the same health topic with the community? I lived in North Carolina for a while, and I was working on a project that was focused on diabetes in a particular neighborhood. And it was because I had a community partner that was based in that neighborhood. And as I'm chatting with people there, I was new to North Carolina. They're like, oh, somebody came in here 5 years ago, and I feel like they did this exact same thing. It's like, oh, that would have been helpful to know. But, again, really understanding the context of the communities that you're going into, not just from your own institution, but who else has been there, who else has worked on diabetes in this space, and knowing that before you go is important. 2, what is necessary for engagement to occur? So that involves capacity on both sides. That involves the timing. So for example, is this a good time for your community partner to engage with you? Do they have the capacity staff-wise to engage with you? Is there funding both either on your side to provide funding to your partner? Does your partner have their own funding that they're trying to use for this topic? So thinking about kind of what do we need? Do we have the capacity here? And is it a good time for this project? And then lastly, what to consider for engagement to be successful. So thinking about, we've talked about this a lot, kind of equitable power sharing. So who's in charge of what? Who's setting the goals? Who's setting the objectives? Who's leading the meetings? Even things like that. Thinking about the long-term commitment. So you've written a 5-year grant. Is the commitment that we're going to work on this project for 5 years and then you're never going to see me again? Or is the commitment that hopefully, at year 4, we start to think about what have we learned here and what's the next grant that we'll write that's again responsive to the community's needs. Thinking about a continued effort to increase capacity. So as you see needs, thinking about how can you address them? How can you increase capacity? How can you help people level up on their skills if that's what they're interested in? Also, an open dialogue and transparency when conflict arises. We know conflicts will arise. That's what happens when the humans interact with other humans often. And so thinking about how can you be open, how can you be clear about expectations up front, hopefully to minimize conflicts in the future, but also being very transparent. So for example, oftentimes we start projects with community partners and we have a set of objectives that we've identified. And maybe through the project, you actually realize that, actually the problem is something else. But again, as researchers, we are responsible to our funders. We can't just say, actually, we're not going to do this anymore. We're going to do something else. So thinking about, in terms of that, what is the responsibility? What is the conversation with the partner about? Yes, maybe this is the next step, but we have to finish out this project. How can we be responsive to that? And thinking an eye towards sustainability. If we're always looking to fund our partner, but have not supported our partner in finding their own funding, are these projects really sustainable? And then really fostering trust that it's bidirectional, that we know that they know that when we come to chat with them that it's going to be respectful and that they believe that we're going to do the things that we say that we're going to do. Does anyone have any questions here? Or comments? They don't have to be questions. Thoughts? Let's see. So now we're going to do an activity. I'm going to put a link in the chat. We're going to do Let's Get Principled. And so hold on. I have learned that I cannot speak and click through things at the same time. So just give me a couple seconds.
Do you want me, we were going to count off if we were in person, but do you want me to do the breakout rooms for you?
That would be fantastic.
It's going to be random if that's okay.
Yes, love it.
All right, I'll make sure you, whoa. I have a very strange breakout room set up.
So here is, uh-oh, not the same. Oh no, sorry. I want to click on the chat box, but it won't let me. Okay, there we go. Let's see, to everyone. So here is the link to a Google Doc. Okay, perfect. I see people joining. So what will happen is you will, sorry, let me go back to the slides because now I realize I'm not sharing. Okay, so Lisa's working on forming the groups. I put the link for the chat. So in your group, what you're going to do is you're going to make a slide for your principal and then be prepared to tell the class the answers to these questions. So what is the principle? Why is it important? How could you implement this principle? And what are some pitfalls to avoid implementing it? And there's a note, you cannot use words on your slide. So you're getting pictures, you're putting things. This is an art exercise, okay? Let's getting principle. And so if you go to the Google Doc, what you will see is that we have a link for the resources to the document in the first slide. And then we've assigned the principles to the groups. And then if you go further, you can see each group has their own slide that you can put your pictures into. So, and again, also on slide 4 are the questions that we are asking. Does anyone have any questions about this activity before we break out and you get started?
But just to note, the principles start on page, I think 43 of the PDF that's linked there. And where there's a placeholder for like your group, make sure you create a separate slide for each principal.
Yes, fantastic.
All right, I'm going to open all rooms. Tainayah, you're in a room, but somehow I can't create rooms without that happening.
No
it looks like I don't have everybody here. I'm gonna hold on. I'm gonna do it again. 1, 2, 3, 1, 2, 3. Okay, I think that works better. Okay. All right. Everybody see their rooms?
Yes.
And Tainayah, we should tell them how much time they have. I can broadcast a message.
Oh, yes. So let's see. It is 3:38. Maybe we give them, because class goes until 4:20.
4:20. So we just need like 5 minutes. Oh, well, they'll need to present back at the end, right?
Right. Oh, I can just click not now and not go to the breakout room.
Yeah.
Yes. So because I think I only have one more slide where we talk about the announcements for next week. So maybe we give them until 4 and then give each one, or so 3:55. Would that be enough time?
Like give them 15 minutes.
Yeah.
Okay. Broadcast message. Oh, you can broadcast your vote. Okay. You have 15 minutes to create your slides. We will come back just before 3:55.
Perfect.
All right.
I see it at the top. Broadcast.
Yeah. Okay. I can't see it because I think the thing is in the way. There's like things I like about teaching online, like the breakout rooms and the chat and the Jamboards and all that kind of stuff. And then of course that takes extra I don't know, bandwidth or something.
Yes, it does. I was like, I wanted to have people there. And then I was like, oh, where do I put them so I can actually see the slide, the information on the slide? And I kept like moving everyone around. I was like, oh, this is, I've never taught online before.
Oh,
It's my first time. Yeah.
Oh, yeah. Sorry. Okay. Yeah. It's, I don't know. It's like, well, it's like nice, but there's also things that are challenging.
Yeah. I like it. It wasn't particularly hard. I was just like, oh, logistically, I just need to figure out where to put people.
Yeah.
And then at one point I was like, I'm just going to minimize them.
Tiffany wants help. Okay, let me go. I think the slides are set up as view only. Can you change it?
Yes.
I tried, but it looks like I'm not the owner.
Yes. Okay. Okay. So if I go, oh, I see, viewer, editor. Okay. I just updated it where anyone with the link can edit. Yeah, because I just duplicated yours because I didn't want to delete the ahead ones. So I just like duplicated it and then did that.
Yeah. Let me go tell them and see if it worked.
Okay.
Okay.
Did they say it worked? It should work.
Yeah.
Oh yeah, and now I see that I have all these share requests from everyone asking. Just kidding. Okay, yeah, I see people adding slides and making things, so it looks like it's probably working. Perfect. Oh, since we're here, when do you want to meet about class next week?
Oh yeah, I'm sorry I didn't answer that. I looked at my calendar and like freaked out, and then I didn't.
Look, we could just text if we need things in between. Like it does like
so yeah. So no, sorry about that. That's like I'm terrible at calendar stuff. So next week we have identity and Diana and we have the community partners coming, right?
Yes.
And then
so
we
I'm
have
doing all the identity slides and all those things, and then I'll do the identity presentation, and then we'll have
and then I'll introduce Diana, and then I'll do the community partners, and I'll be dealing with the Zoom issues while you're doing your lecture.
Right, to get everyone perfect. Yes.
So maybe we're okay. Diana emailed me with some readings, and so that was the one thing I wanted to ask you. She had one that she really wanted people to read. She said required. I was like, whoa. And then she had one that was, just information if they were interested in more. So let me see what readings we had. Oh, geez. What readings we had for next week, because I don't want to give them too many because they also have this week's readings to do,
Right. No, it's so funny that you say that. I'm presenting in the EPI seminar next week, and Kevin sent me an email and he was like, oh, could you send me the name of your talk and any readings? And I was like, readings? It's like, was I supposed to like went into a mini panic. Like, oh, should I have readings? Should I have had readings?
Yeah.
Guess it's not too late for me to pick a reading, but yeah.
Okay, so we only have 2 readings. So I think giving them another one is okay, right?
Yeah, I think so.
And this one by AJ is short. This one's a little bit longer, but I think it's okay.
Yeah. And I think also in the context of like, even for this week's readings, I mentioned that, it's like, I try not to say just skim them, but like try to be, kind of say that like, so.
Okay, so let's see. I need to add Diana's readings. Okay, perfect. All right, I need a bathroom break and I'll be right back.
Yep.
Yeah, thank you for doing a seminar. I've never been asked to do seminar, which I'm super thankful of, and I've scooted under the radar since forever, apparently. Or no one's interested. I have no idea.
Maybe everyone, maybe because you do so many other presentations, people feel like.
Don't care. I'm not offering.
I'm excited.
Thank you for doing it. They had a great presenter this Tuesday. I really liked her, Sarah Bleich. She's at the USDA and she's the head of like nutrition security. And I think it was like completely different than what anyone has ever had. She's a former mentee of Elise and she's a professor at Harvard, but she's on leave, has been at the USDA. She was like at the Obama administration. She worked with Let's Move and it's really, really cool and talked all about food policy and working in the federal government. And so I think people were just like, food insecurity, what does that mean? And she would be like, how many people know about this? And they were like blank stares. So your follow-up will be awesome, because it'll be like, no, we're really gonna be talking about this stuff all quarter. Not all quarter, because some of them are not people I invited, but
Yeah. I am like kind of redoing my job talk slides, because like I want to do the, hey, this is me piece, but then also really focus it on like community engagement and like mixed methods, and like give some examples of those. So like a photo voice example, and like, so I'm putting together some slides, like talk about that I'm going to talk about a community advisory board that I put together for another project. So just try to give them some examples of different things. And then I'm going to talk about 2 mixed method studies and different ways to integrate mixed methods.
Perfect.
Because I'm like, I think I should distinguish between when people do multi-method studies and like what exactly mixing methods is.
Yep.
And so trying to.
Great. I will do your introduction. So send me what you'd like as a bio.
Literally read it from the Stanford
That's the
profile
one you want.
website.
Okay.
Yep. Got nothing else.
Perfect. I was going to say, or I'll scour the internet and find out things about you.
Yeah. You can read my Stanford profile. It's exactly what
I hope that you can't scour the internet and find out things about me. I should figure that out.
I Google myself randomly just to make sure that
see. Yeah, I know my kids were
out there
Googling
is like
my
legit.
kids were Googling me the other day, and I was like, oh my. There's a lot of
recently and found my whole address, and I was like, please take this down. And they did do that. They did. Google did take it down, but I was like, oh my, like that's
that's concerning. I think during the pandemic, when all that Scott Atlas stuff was happening and we were getting letters from Trump's lawyers, I made sure that like nothing about me on the Stanford website is public, because it really freaked me out.
Yeah.
But there's a lot of YouTube or like videos now, because I did these town halls in the pandemic. And that's the part that really is like, oh God, I really wish that stuff was not there. You know, you hate seeing yourself talk, and you're
yes. Yep.
And it's like the early days of the pandemic. You can tell I'm like freaking out. It's better than this one. It used to be from the Kellogg postdoc that I did, the Kellogg Health Scholars postdoc. The picture they took of me, I was next to Daryl Hudson. I don't know if you know him, but he's at WashU. He's like a big guy. He looks tiny next to me because I'm like 42 weeks pregnant and have preeclampsia. So I'm like super swollen.
Oh no.
I looked like Michelin Man. And I was like, please take that picture down. Like, that's the only thing that would show up when you Googled me. And I'm in this big, like, red shirt. Oh, so horrible.
Oh, no.
It's gone now, thankfully. I don't know where it went,
good.
but I don't need to know. No one needs to see that.
Yeah. That's why when people are just like, oh, no, we'll just take a picture and put it on a website. I'm like, let me see it. Like, please actually don't do that. Like, I can look really awkward sometimes. I'm like, let's not do that.
Okay, I'm going to broadcast. It looks like I'm going to refresh. It looks like they're almost done.
Perfect.
So I'll say like 2 minutes left.
2
minutes left. Okay. Seems like a great group.
Yeah. I'm excited. I'm excited for the quarter.
Group 1, principal 2, they're nothing yet. Group 1, principal 3. Group 1 has spent a long time on principal 1. Group 2 is going for it. Okay. And group 3, they've got principal 8, 9. They have not made it to, there's 9 principals, right? Yeah.
Yes. Yeah. So it's just 3 each. So yeah, they may have an extra slide there, but I think it's only
okay. Perfect.
9 principals. Yeah.
Yeah. So it's just group 2 that is struggling to put some pictures on.
Well, hopefully that 2-minute warning ignited a fire, and they'll.
Okay. Ooh, baby.
Oh, so then should I share my screen for that. How should we do presentation back? Sorry, I'm just like thinking through this now.
Yeah, yeah, you can share your screen with those slides, right? And then they can just present.
Yes, okay. Okay, great.
This whole new RMG thing is really throwing me for a loop.
I feel like since I've been here, there have been like a variety of different
I had the same person forever, even like before I was here as an instructor and then left. It was the same person when I came back, and I was like, we were good. She was really good with community partners. We worked really well together. She was a little last minute for my liking, but like she would talk to you at any time of the day, like 9 p.m., whatever.
Oh, wow.
And then we had this woman, Julie. She was fine, right? I don't know if you met her. And then I just started working with Sylvia, and then boom, you know, I hadn't done any grants until this month, and so I didn't really work with her until now. And I have 5 going in this month.
Oh my gosh.
Yeah, they're all subcontracts to partners who are the leads. So, I mean, I am writing them, but the Stanford doesn't have to submit the budget, but we got to submit it to them. And yeah, it's just Sylvia's been annoying, and now
like literally
she
like a
says
week notice.
one
like,
day to the next that she's gone. I sent Melissa an email and I was like freaking out.
I could completely understand that, because it was like, oh, starting on the 16th, talk to these other people, and it's like, but you just told me to like what, like.
Yep. Oh, my meeting with Ruth O'Hara just got changed. Fascinating.
I need to email her. She's supposed to connect me some people at Valley Care, and then I'm sure she's busy, and it didn't happen. And so now I'm like, oh crap.
My goodness. Ugh, crazy. Okay, so I'll close the rooms. Oh, we're late. It's kind of waiting for watching group 1.
Great. All right, let me see if I can start a share. That's not of the actual slide. Oh, here we go. All right, share. And then let's go here. Okay. Is that everyone? I can't count. Okay, not quite, not quite. Okay, I think we have everyone back now. Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, perfect. Welcome back. As a brief refresher, here were this is what you're supposed to be talking about: the principle, why it's important, how could you implement it, and pitfalls to avoid. So I will go ahead and click here for group 1. So does group 1 want to start on principle 1 and tell us what you have here?
Yeah, so for the first principle, it is be clear about the purposes or goals of the engagement effort and the populations and or communities you want to engage. So in my pictograph, we have like a bullseye or an arrow for you to be clear with your specific purpose, as well as the bottom below is like what type of population you want to engage in. There's a certain area or like demographic you want to reach and target. Why it is important is that it gives a clear framework and a goal to achieve. It also prevents doing harm to the community, such as by not promising too much of something, as well as it helps to not deplete any resources, such as time or money or your energy, which is a pictograph right in the middle. So how could you implement this principle? It could be done through collaboration and asking for feedback, as well as doing proper research and doing extensive research as well, and being open to, I guess, like changes and alterations with collaborating with the community members, other researchers, and etc., which is a pictograph right in the corner on the right, as well as what are some pitfalls to avoid in implementing this principle is having too much of a large scale or too little of a scale in your goal, purpose, and community, which is seen in the pictograph down below, as well as not doing enough research in seeing if it has been done before or if it has failed previously and why.
Great, thank you so much. Okay, and then here is principle 2.
So principle 2 was understanding a community's culture, economic structure, social norms, political structures, and history with previous research experiences and perceptions. And so this is pretty important because first it helps you understand what community resources already exist and which groups or individuals you'll need to get support or buy-in most from. Just as important is learning how this community perceives the researcher, yourself, and your affiliations. And that is pretty important because it helps inform what sort of barriers to your credibility or but just to understand your relationship and the history of your institution with this community. And so this helps build the foundation for meaningful and sustainable partnerships. Some pitfalls are to understand what are already pre-existing efforts. And this is important because you have to understand if your community engagement project will impair or affect these already existing efforts. And the PDF specifically mentioned that a lot of communities are involved with pre-existing partnerships and coalitions like economic development programs or substance abuse programs. And that understanding what exists already will help inform like where your proposed community engagement project will stand. Some ways to implement it, I like how the PDF said, qualitative and quantitative methods from as many sources as possible. So background research here not only means maybe reading up and understanding your relationship, but also getting to know folks in the community and understanding their perspectives.
Thank you. And now principle 3.
Well, principle 3 is go to the community, establish relationship with the people, build trust, work with formal and informal leadership in the community, and seek to have a commitment from community organizations and leaders to create processes for mobilizing community. It's important that there's engagement in this relationship. It's important that both parts are equal to create some support and create some respectful relationships. And engagement is also based on community support because positive changes that you might see in some communities are more likely to occur when the members, when community members are part of a program development and implementation. And all, as I said, both sides need to be actively respected from the start to create a very efficient implementations. How to implement engagement leaders, they find it more effective to reach to formal or informal leaders and organizations. It's like a fraction work because that gives more variety and more information, and where every part of the community could talk and could, feel part of the the study. Also, it's important that both, it's a coalition. It's have to be both parts as equal. And the pitfalls is that there might be some ethical problems with having relations with the community. Like, for instance, manipulating the community to, go to participate in the research, not informing the community what you want to do, and probably lie to them, or use important information that it was not supposed to be shared with everyone. And those are one of the things that it also can be a pitfall. Also, like giving something in exchange, like, for instance, oh, we're going to give you food, we're going to give you this and that, to make the community participate and feel good about it. And, with that, that's not going to work if we're working in these kind of projects, because what really matters is the benefit for the community rather than, some interest of the research team.
Okay, great. And now we're going to go to principle 4.
Yeah, I'll talk about principle 4 a little bit. So the principle, we wrote it on the slides, but so the principle is, remember and accept that collective self-determination is the responsibility and right of all people in a community. So to sort of represent that, we kind of use the first image of this person kind of drawing their own path. So this idea that the community has to sort of lead in that process of sort of deciding what's right for them, and they have sort of that right to make decisions for themselves, and no person can sort of come in from the ivory tower, which is sort of what the second image is supposed to represent of Stanford. No person can sort of come in from outside of the community to sort of make decisions on behalf of the community, or sort of pretend that they're part of the community without kind of consulting people in that process. Yeah, we do in fact have, a tower in it, so sort of how that can look, and what the report sort of talks about is this idea of like empowerment. So empowering community members to make their own decisions for themselves, and that can come sort of internally, so like members of the group uplifting each other's voices, or also externally sort of making spaces for individuals to raise those concerns kind of directly to the researchers. So yeah.
Thank you. And now we have principle 2.
Group 2.
I mean, 5. Sorry, group 2, principle 5. Sorry, the numbers. Thank you. Sorry, principle 5.
Okay, so for principle 5, it's for engagement to succeed, partnering with the community is necessary to create change and improve health. So in the first image on the left, it kind of just shows people working together, and that each person has their own responsibility and they're working towards a common goal. And the handshake image shows kind of like mutual cooperation. How this principle can be implemented is likely in the searching and actively partnering stage. So there has to be trust, common values, shared knowledge, mutual respect, and agreed upon goals. It's also good to have some sort of maybe signed agreement developed. Some pitfalls, conflict, different priorities, and also like mistrust and lack of boundaries, but hopefully all of that can be avoided by communicating clear expectations and roles earlier, like ahead of time.
Great, thank you. And principle 6.
So for Principle 6, it's all aspects of community engagement must recognize and respect the diversity of the community. Awareness of the various cultures of a community and other factors affecting diversity must be paramount in planning, designing, and implementing approaches to engaging a community. I think, as you can see on our slide, we wanted to represent that there are many facets in which diversity can appear, whether it's from age, gender, race, ability. And then we wanted to show that, I think, really, why is it important? I think that inevitably we each have our own identities that are formed in different capacities and have unique perspectives on how to address various issues. And it's crucial to accept the diversity of others, to really think holistically from different perspectives of how to address a problem. I think it's important because you then can work together and create a culture of respect, ideally, to think about how to address inequity. I think the way that we would hope to implement this is, one, I think, an acknowledgement that this can sometimes be uncomfortable because there is checking of our own biases and thinking through what diversity looks like, and requires, I think, a lot of self-reflection. But I think the goal is to really work together. Common pitfalls, I think, can be, unfortunately, just assumptions and stereotypes that we all are wanting to be influenced by. And so checking that as we try to really use this principle.
Thank you. And Principle 7.
So Principle 7 is community engagement can only be sustained by identifying and mobilizing community assets and strengths, and by developing the community's capacity and resources to make decisions and take action. So this really involves like looking at the interests and skills and experiences of both individuals and groups within a community, and then also recognizing the networks that connect these individuals and groups. So that's kind of like the top couple of photos there, and then also understanding like the assets that the community has. So that can be, you can go through and like map out different facilities and within a community to understand what the residents of the community have available to them. So that kind of explains like the map photo. And it's important because using these existing resources and understanding the capacity of the community in terms of these facilities, materials, skills, economics, and more, they all can be used to make decisions and take reasonable action for the community that capitalizes on these strengths. And some pitfalls might include like overlooking certain groups or individuals in the community and maybe not recognizing how they're connected or what they could bring to the table. And the book also touched on how it's important, although it's important to use these existing resources, failing to create new resources and capacities can sometimes make it hard to make these changes sustainable. So you need to help communities to develop the infrastructure and skills to analyze situations, make decisions, and take action on their own.
Fantastic. Thank you. Principle 8.
Yeah, I had Principle 8, and Principle 8 is the that organizations that wish to engage in community or engage a community as well as individuals seeking to affect change must be prepared to release control of actions or interventions to the community and be flexible enough to meet its changing needs. So I kind of interpreted this as, you know, the releasing of control shows the control room with like a slash through it, and then kind of representing flexibility through the people stretching, because it's really important for especially like big name institutions who are coming in to do research and partner with communities that they recognize that they're coming from, you know, maybe different walks of life, different cultures, and that the researchers or who would be considered the experts don't necessarily have the best grasp on the community or the context in which they're trying to serve. So then here I also have the picture of the two men shaking hands to show like community bonding, community trust. And then a major element of this principle that's also represented in that picture is that building that trust and allowing the communities to be able to do their own action, their own community-led action is really kind of the goal of this principle. So empowering communities to build those bonds and things is super important and will definitely contribute to Principle 8. Implementation of the principle can look like institutions such as Stanford partnering with community partners in order to build, teamwork and to build trust between those communities. We have to remember that a lot of communities are interacting with institutions from a not so great, perspective or historical interaction, just history. So building that trust and showing that, it's a mutually beneficial relationship is really important for that. And that can be done through good communication, like a communication liaison or something, and then community advisory boards that we're talking about. And finally, some things to avoid would be like changing the goal of your study and, not necessarily talking to the community that you're serving. Additionally, like only being around for a small period of time and not being able to adapt to the needs of the community and not really being flexible in that way could be a pitfall that we really shouldn't fall into.
Okay, so Principle 9 is that community collaboration requires long-term commitment by the engaging organizations and its partners. And this is important because community engagement requires trust and mutual understanding, and these things just take time. It's not a process that you can rush. I don't think you can really expect to gain meaningful collaboration or sustainable outcomes without long-term planning, and rushing the research process can actually damage the relationships a researcher or an institution might have with a community and also reduce the effectiveness or mutual benefit of your project. So I think projects that prioritize long-term collaboration and building of like relationships and partnerships are going to have a greater, more engaged, and often more sustainable effect on health. As far as implementing the principle, I think being intentional about how you're co-leading with community partners and stakeholders are going to ensure that long-term planning and commitment can take place. This often looks like jumping through like necessary requirements in order to collaborate with that community, like setting up a community advisory board or going through different like internal review boards. I think a researcher can also factor in the time that it's going to take to do a community-based project from the very beginning of the research project as they apply for funding and connect with community partners so that they are able to set reasonable time expectations, not just for establishing the researcher's long-term commitment, but ensuring that the community collaborators also are able to meet their needs in the scope of the project. In general, I think research often takes more time than you think it's going to take, so it's better to expect a longer project timeline than you would initially estimate. And thinking about like frequency of follow-up and establishing milestones is also key to maintaining a long-term commitment to a project. As far as pitfalls to avoid, I think pressure to rush the research process by funders or collaborators, which can happen when you're not setting reasonable expectations on the time that's necessary for the research project. Also, not maybe thinking about funding or resources that you might need over that longer period of time, or underestimating how long your project will go could be a pitfall. You also want to ensure that you're not burdening community partners with a time commitment that may not be realistic or reasonable for them, and plan on how you're going to handle that, especially if a community partner is not able to collaborate over the extended period of time.
Perfect. Oh, you're on mute, Tainayah.
Yes, thank you so much. We hope that exercise help you really get a more like intimate understanding of the principles. And we just have a couple of minutes left. So I am going to just do some last little reminders. So announcements. So assignment 1 is due next week. So please don't forget to submit that. If you have any questions, please feel free to reach out to Lisa and I, and we can help, but also refer back to the syllabus because we tried to give you a pretty comprehensive overview of the assignment there. Please do the readings for this week and next week, with a reminder again that the readings that were assigned for this week really are to provide you with an overview of these concepts. And so kind of treat them as that. We'll come back to some of these concepts later.
Can I say one thing about the readings? Our guest next week, who's going to talk about identity and her research during her dissertation, provided 2 additional readings that I added to the syllabus just now and replaced the syllabus. I'll also put it in an announcement. They're not, one is optional and one is just a fact sheet. So it's not a lot more, but a little bit more. Sorry, keep going, Tainayah.
And that's what to expect in class next week. No, you kicked it off, Lisa. So we'll spend some time discussing your experience with the assignments. Our community partners will be here to present to you potential projects, and then you'll indicate your preferences for the group project. And we'll also have a speaker who'll come and talk a little bit about identity. So that will happen next week. And then we'll add the readings for session 3 to Canvas. And if you have looked ahead and looked at session 4 and become concerned, don't worry. Don't worry at all. And then, as Lisa mentioned earlier,
that one's outdated, the date. So I'll update it later.
Okay, perfect. But just, there will be a call for abstract soon. Just be on the lookout. And I think that is all the time we have. Let's see, stop share. Thank you all so much. It's so great to meet you all. Again, Lisa and I are available. If you have any questions, comments, concern, please reach out to us. We really look forward to working with you all this quarter.
Thank you.
Thank you.
Thank you.
Bye.
See you all in person next week.
Yes.
All right, I'm sending the message about the readings. There we go. Okay.
It was also not lost on me that we have a ivory tower on campus. I was like, as we were sitting here, I was like, oh my gosh, it's literally.
I know.
Yeah. So it was like, oh gosh.
So Viviana is your student, right? It just clicked with me. Okay. Yeah.
Yes, she
is. Is she doing okay?
Well, I talked to Rita. So we didn't end up meeting. She had to reschedule because you see, she was like a little sick. So she was, so, and I was like, yeah, that's fine. And I asked Rita about it, and Rita was like, she thinks because she had like a respiratory infection last quarter. It was out for like a whole bunch of weeks. And she's like, she just felt like it was like she came back and just couldn't catch up, and that she doesn't really think it's like a reflection of her as a student. She told me not to worry about it. They're not worried about it. Okay. And just to see how this quarter goes. And I was like, oh, okay. Just like, I don't know if I should be concerned. He's like, don't worry about it. We get it. We totally get her context. So like, don't be concerned. So that was nice.
Good. This friend of mine, I have a co-PI who's a pediatrician, and she was like, it's like everybody's going to preschool for the first time. And you're supposed to get 6 to 9 colds in your first preschool year. So apparently that's what we all have in store for us.
Oh gosh.
I was like, please no. Mateo has definitely ticked off like at least 4.
Oh gosh. Yeah, I'm not excited about that. I mean, I'm glad that we're gonna be masking. I haven't seen these classrooms. I don't know how big they are. I'm like hoping, because it's
101 is pretty big. So we should be fine. It's big. And 205, 206 is also big. And so I think we'll be totally fine. And when I went to class on Tuesday for a seminar, I would say everyone was masked. So it wasn't bad.
Okay. I'm like, fingers crossed. I'm like, maybe that cuts down on half the colds.
Yeah. Who knows? Who knows?
Yeah, we'll see.
Yeah. Rita's never masked, which is so funny. And she, has been the one who's been teaching in person probably more, except maybe Kristen. And so she hasn't gotten it. Her husband has gotten it, and she's literally like, she was like, I wanted to get it. I like used his toothbrush and I didn't get it. So I think she's
okay. Someone needs to study her. I think we need to study her. There's something happening there, and we all need that resilience. I
think it's Rita's like zen about life. She's like I don't know.
Yeah.
So crazy.
Wow.
Okay, good. Well, 1 class down, 9 to go.
Yes, we did it. Perfect. Okay, so I'll go ahead and just Yeah, I'll let you know if I need anything, but I think we talked about next week, so I feel good about
we're
everything for
fine.
next week. So I don't think,
Yeah, I
yeah,
think we're
anything
good.
comes up, let me know.
Okay.
And I'll make sure I look at the fact sheet too, in case, Diana's like,
Yeah, I need to
"Any
read it too.
questions for me?"
I've never met her in person, but she seemed really great. So I think it'll be good.
Fantastic.
All right. Very cool. Well, have a good weekend. Stay dry. Oh, have fun. You're not here. Have fun in Atlanta.
Thank you. I'm like it. So I think today was the day for the rain. I think we're past the tornado watch, and I think maybe I'll actually get some sun over the next couple of days. So
Yeah,
fingers
it's
crossed.
not bad here. It's weird. All right, cool.
All right,
I'll talk to you later.
bye.
Bye.